As we age past 60, one of the most visible and emotionally challenging changes happens right on our face: deepening wrinkles, thinning skin, loss of elasticity, and a tired appearance that seems to appear almost overnight. For many adults, this is not just a cosmetic concern, it becomes a daily reminder of aging, often affecting confidence, social comfort, and self-image. What most people don't realize is that this visible aging is not only about time, it is closely linked to declining collagen production, reduced skin hydration, and slower cellular repair. Today, you will discover a natural approach inspired by a traditional Japanese banana face mask recipe that may help support skin hydration and elasticity when used consistently as part of a gentle skincare routine. I am Dr. Walker Official, and for over 25 years I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. Here is what makes this topic so important. Research shows that collagen production in the skin naturally declines by about 1% per year starting in early adulthood, and by the time we reach our 60s, the skin may have lost up to 30–40% of its structural support. Dermatology studies also suggest that more than 80% of adults over 60 notice visible skin thinning and increased dryness, which directly contributes to wrinkle formation and sagging. But the real danger is not just appearance, it is the psychological impact. Many seniors begin avoiding photos, social events, and even outdoor activity because they feel less confident in their skin. This can slowly reduce independence and quality of life. In this video, I will break down what is really happening beneath the skin, and I will also walk you through a ranked list of natural supports, including foods, habits, and topical approaches, ending with a simple banana-based mask approach that many overlook. But there is also one very common mistake almost everyone makes that can actually accelerate wrinkle formation instead of slowing it down. As we move deeper into understanding facial aging after 60, it is important to look beyond surface-level changes and focus on what is actually happening inside the skin at a biological level. Wrinkles are not simply lines of age appearing randomly. They are the visible result of structural breakdown within the skin's deeper layers, especially in collagen, elastin, and the skin's natural moisture barrier. At a scientific level, the skin is supported by a dense network of collagen fibers, which act like scaffolding, keeping it firm and smooth. Elastin allows the skin to stretch and return to shape, while hyaluronic acid helps retain moisture and volume. However, after the age of 50, multiple biological processes begin to slow down simultaneously. Fibroblast cells, responsible for producing collagen, become less active. Blood circulation to the skin also decreases, reducing oxygen and nutrient delivery. As a result, skin repair becomes slower and damage accumulates more easily. Clinical dermatology research suggests that collagen levels decline by approximately 1% per year starting in the mid-20s, but after 60, this decline becomes more functionally noticeable because the skin's ability to compensate is significantly reduced. Studies published in geriatric skin health journals show that postmenopausal individuals, in particular, may experience up to a 30% drop in skin thickness within the first 5 years after hormonal changes accelerate. This is why wrinkles often appear more rapidly after major hormonal shifts and aging milestones. Another key factor is chronic low-grade inflammation, often referred to by researchers as inflammaging. This process gradually damages skin cells at a microscopic level, breaking down collagen faster than the body can rebuild it. Combined with reduced antioxidant defenses, the skin becomes more vulnerable to environmental stress, such as UV exposure and pollution. Even more important, clinical observations show that standard skincare routines often fail to address this internal decline. Moisturizers may temporarily hydrate the surface, but they do not restore collagen production or improve cellular regeneration. This is why many people feel like their skin stops responding to normal creams and treatments over time. What makes this issue more complex is that aging skin still responds to biological stimulation, but only if the correct pathways are activated. Researchers in dermatological science have found that skin regeneration can still be influenced through targeted nutrition, improved microcirculation, and certain plant-based compounds that support fibroblast activity. This means that while skin aging is natural, the rate and severity of wrinkle formation are not fixed. They are influenced by internal biology, lifestyle habits, and nutritional support, opening the door to meaningful improvement even after 60. Now that we understand what is happening beneath the surface, the next step is to identify why many common anti-aging approaches fail to deliver real results, and what critical mistakes may actually be making the problem worse instead of better. Now that we understand the biological changes happening beneath the skin, it becomes much easier to see why many popular anti-aging habits do not deliver lasting results. In fact, some widely recommended approaches may only create temporary improvement while allowing the deeper causes of wrinkle formation to continue unchecked. One of the most common mistakes is relying only on surface-level moisturizers and anti-aging creams. While these products can temporarily soften the appearance of fine lines by increasing hydration, they do not rebuild collagen or restore elastin fibers. The skin may look slightly smoother for a few hours, but internally, the structural breakdown continues. Over time, this creates a cycle where people feel like their skin becomes dependent on products without real improvement. Another major misconception is the belief that drinking more water alone will fix dry, wrinkled skin. While hydration is essential for overall health, water intake does not directly translate into improved skin elasticity in older adults. The issue is not just external dehydration, it is the reduced ability of aging skin cells to retain moisture due to a weakened lipid barrier. Without repairing this barrier, excess water intake has limited visible impact on wrinkles. A third common mistake is overexfoliation or using harsh treatments in an attempt to renew the skin. In reality, aggressive exfoliation can damage the already fragile outer layer, increasing sensitivity and accelerating moisture loss. Clinical dermatologists have observed that over-treated aging skin often shows faster wrinkle progression due to chronic barrier disruption. The key issue behind all these approaches is that they focus on symptoms rather than the underlying biological decline. They temporarily improve appearance, but do not address collagen loss, reduced microcirculation, or cellular slowdown in the dermis. However, recent studies in skin regeneration suggest an important insight. Aging skin is not permanently inactive. Fibroblast cells can still respond to natural bioactive compounds, improved nutrient delivery, and gentle topical stimulation. This means that while aging cannot be stopped, its visible effects can be slowed, and in some cases partially improved, when the correct biological pathways are supported consistently. This is where the concept of reversible decline becomes important. Instead of treating wrinkles as a fixed condition, researchers now view them as a dynamic process influenced by ongoing cellular activity. In other words, the skin is still capable of responding, it simply needs the right type of support. With this understanding, we can now move into the most important part of this video, a ranked breakdown of natural foods, drinks, and habits that actually influence skin structure from the inside out, starting from the least effective and moving toward the most impactful approaches. Let's now break down the most relevant foods, drinks, and daily habits that influence skin aging from the inside out. These are ranked not as quick fixes, but based on how strongly they support hydration, collagen stability, and cellular repair over time. Starting at number 10, green tea appears frequently in skin health discussions. It contains catechins, which are antioxidants that help reduce oxidative stress in skin cells. Some studies suggest regular intake may improve skin elasticity markers by around 5 to 8% over time. However, its effect is mild and indirect, and it cannot rebuild lost collagen on its own. Verdict: supportive, but not a standalone solution. At number 9, cucumbers provide hydration and silica, which slightly supports connective tissue health. While they improve surface hydration and freshness, their internal impact on deep wrinkles is minimal. Verdict: refreshing but limited structural effect. Number 8 is avocado. Rich in healthy fats and vitamin E, it supports skin barrier health and moisture retention. Research indicates it may improve skin smoothness by around 10% with consistent dietary intake. The limitation is that results take time and depend on overall diet quality. Verdict: useful for moisture support, not deep repair. At number 7, olive oil provides anti-inflammatory compounds that help reduce skin inflammation. It supports lipid barrier function, but excessive intake may add unnecessary calories without directly increasing collagen production. Verdict: beneficial but indirect. Number 6 is bone broth, which contains collagen peptides. Some studies show mild improvement in skin elasticity, around 10 to 15% in small trials, but absorption varies widely between individuals. Verdict: promising but inconsistent. At number 5, vitamin C-rich foods like oranges and berries play a critical role in collagen synthesis. Without vitamin C, the body cannot efficiently form collagen fibers. Regular intake supports measurable improvements in skin repair processes. However, it works only if protein intake is also adequate. Verdict: essential cofactor, not a complete solution alone. Number 4 is resistance-based physical activity. Surprisingly, exercise improves skin indirectly by boosting circulation and oxygen delivery. Clinical observations suggest improved skin vitality markers in active seniors by up to 15–20%. Limitation: requires consistency and does not directly rebuild facial structure. Verdict: powerful systemic support. At number 3, adequate sleep becomes a major skin repair factor. During deep sleep, growth hormone levels support tissue regeneration. Poor sleep accelerates visible aging significantly. However, sleep alone cannot reverse collagen loss already present. Verdict: critical for repair, not reversal. Number 2 is omega-3 fatty acids from fish like salmon. These help reduce inflammation and support membrane flexibility in skin cells. Studies show noticeable improvement in skin hydration and roughness over several months, sometimes up to 20%. Limitation: dietary consistency is required. Verdict: strong structural support. Finally, at number 1, the most impactful category is a combination of antioxidant-rich natural compounds paired with gentle topical application. This is where traditional remedies like the Japanese banana-based face mask become relevant. Bananas contain natural enzymes, potassium, and moisture-binding compounds that can temporarily improve skin softness and hydration while supporting surface-level smoothness. When used correctly, they complement internal nutrition by improving immediate skin texture, especially when paired with a balanced diet. However, even this top approach works best only when the skin barrier is healthy and internal collagen support is not neglected. Now that we understand the full ranking of natural supports, the next step is to focus on the top 3 most effective strategies in detail, including exactly how and when they should be used for best results, especially the banana-based method that many people overlook. Now that we have ranked the most relevant dietary and lifestyle supports, it becomes clear that only a few approaches truly influence skin structure in a meaningful way after 60. The top 3 strategies combine internal nourishment, circulation support, and gentle topical care, working together rather than in isolation. At number 3, omega-3 fatty acids from fatty fish such as salmon, sardines, and mackerel play a crucial role in maintaining skin cell membrane flexibility. When cell membranes are healthier, they retain moisture more effectively and reduce inflammation that accelerates wrinkle formation. Clinical nutrition studies have observed that consistent omega-3 intake over 8 to 12 weeks can improve skin hydration and reduce roughness by nearly 15 to 20% in older adults. The limitation is that benefits are gradual and depend heavily on consistent intake. A realistic approach is 2 to 3 servings of fatty fish per week or a daily fish oil supplement under medical guidance. A mild side effect in some individuals is digestive discomfort or fishy aftertaste, and caution is advised for those on blood-thinning medication. At number 2, vitamin C-rich foods such as oranges, strawberries, kiwi, and bell peppers are essential for collagen synthesis. Without vitamin C, collagen fibers cannot properly stabilize, which directly affects skin firmness. Research in dermatology shows that adequate vitamin C intake can improve skin repair efficiency and reduce visible signs of photoaging over time. The best approach is daily intake through whole foods rather than supplements alone, ideally spaced throughout the day to maintain steady levels. A possible mild effect is stomach sensitivity in high doses, especially from supplements, so food-based sources are generally safer and more sustainable. Now at number 1, the most impactful and often underestimated support is a combination of gentle topical nourishment and internal hydration support. This is where the traditional Japanese banana-based face mask concept becomes relevant as a supportive skincare practice, not a cure. Banana contains natural silica-like compounds, potassium, and moisture-binding sugars that can help temporarily improve skin softness and surface hydration. When applied as a mask, it may help the outer skin layer feel smoother and more supple by reducing dryness and supporting the skin barrier. A simple application method involves using a fully ripe banana mashed into a smooth paste, optionally mixed with a small amount of plain yogurt for mild lactic acid support. It is typically applied for 10-15 minutes on clean skin, then gently rinsed with lukewarm water. This can be done 2 to 3 times per week. One harmless side effect is temporary skin stickiness or mild sensitivity in very reactive skin types, so a patch test is always recommended first. A medical caution is that individuals with known fruit allergies or highly sensitive skin conditions should avoid direct application. What makes this approach more effective than others is not the mask alone, but its synergy with nutrition and circulation support. When the skin is already receiving adequate omega-3 fats and vitamin C internally, gentle topical hydration helps optimize the outer layer's appearance, making fine lines less visible and improving overall texture. In simple terms, the most effective strategy is not a single remedy, but a combined system that supports skin from the inside and outside at the same time. Now that you understand the top 3 most effective approaches, we can move to the final section where we highlight the most critical mistakes to avoid and a simple 30-day routine to begin supporting healthier, more resilient skin.